Good evening, welcome, bonsoir, bienvenue. Welcome to the first JDRF House Party for a Cure presented by Omnipod Kickoff Week Mid-Session. These information sessions are possible by our event sponsors, Omnipod, Sun Life, Bell Media, Sunripe, Abbott Diabetes Care, Tandem Diabetes Care, Lilly, and Medtronic. As a note, we will be recording this session to ensure it will be available to share with the ones that were not able to attend today. We would like to thank each of you for attending tonight's presentation with our presenting sponsor, Omnipod. We are very grateful to have Gabby Boucher, Territory Manager at Omnipod, join us tonight to discuss the Omnipod system and answer any question you may have. If you would like to ask Gabby a question, please enter your question in the Q&A section. At the bottom of your screen, there is Ask Your Question button. You just need to put your question in there and we will transmit them to Gabby. For our French participants, pour nos participants francophones, vous pouvez utiliser l'option de sous-titrage dans les réglages à gauche de l'écran. Vous pouvez poser vos questions en français. Et puisque notre invitée parle français également, elle va pouvoir vous répondre. Now, I'm pleased to hand it over to Gabby. Gabby?
Bonsoir tout le monde. Hello, everyone. Good evening. I'm so happy to be here with you. I'm Gabby, Territory Manager for Omnipod based out of Montreal. And first of all, I hope that you are all keeping safe and healthy. Just like you, I'm sitting here, I'm in my home. I've been here for 7 weeks, really not going anywhere, just sitting in front of my computer and watching my hair grow long. So tonight's presentation really, for me, is, at least when I reflect upon these uncertain times that we're living right now, tonight's presentation is a true testament to Darwin's theory of evolution. When we are forced to make modifications, change, and adapt, we're able to do that very quickly. So my screen time has gone up tremendously in the past 7 weeks. I've been doing most of my work by video conferencing, and I'm just really, truly glad to have the opportunity to be with you. Since we couldn't do this in person, at least we can get together and answer some of the questions that you may have. So certainly I would like to thank JDRF for the opportunity to be here with you and entering your homes and share some of the information I have on the Omnipod system. Given that technology nowadays is so important, certainly on a medical standpoint, Omnipod has a great technology to offer and to allow you to better take care of your diabetes. So, so again, I joined Omnipod a little over 3 years ago after more than 20 years working in the diabetes industry. Certainly met thousands of patients in this time, of which many have become my personal friends. So as we are all concerned about this pandemic and the threat that it poses to our health, I know that all of you have the additional concern to keeping diabetes on top of mind and maintaining control amidst everything else that's happening currently. So certainly I can appreciate that and would like to present a technology that can help you do that without increasing the burden, actually with reducing the burden that you go through on a daily basis. So my goal for today is to really just give you an overview of Omnipod, the different components, the different technology, and see what it can bring different and better to your life as a person living with type 1 diabetes. So before I actually start, I want to tell you a little bit about the personal story behind the creation of Omnipod, because it is a nice story to tell. This is a company that was built out of a need for comfort and simplicity and control for patients living with type 1 diabetes. So the founder of Omnipod is John Brooks. He is a father of, or at least he had at the time of diagnosis, his child of 3 years of age was diagnosed with type 1 diabetes. And the center where he was being followed quickly suggested that they move over to an insulin pump because it does provide better control, better quality of life, more flexibility in your day-to-day management, especially in a 3-year-old child. But at the same time, the presentation of the pumps that were available on the market at the time did not allow for tubeless options. So the physical constraints of having to live with a medical device attached to you was something that that he decided to, to address. So he was an engineer by trade and basically gathered a group of experts around a table and created Omnipod in a design that would first and foremost ensure precision and reliability of a medical device as such, but also provide comfort and freedom that patients need and deserve when you go through your day-to-day activities. So let me just move on. So again, I just want to quickly with you review some of the unique features of Omnipod. I want to show you specifically how to prepare and put on a pod, just to show you how easy and simple that can be. And I also want to let you know how to get started on Omnipod if you are interested. So Omnipod is really a very easy system to use. There are only 2 components to the system. So on the left-hand side, you have the PDM, which stands for Personal Diabetes Manager, and you have the tubeless pod, which is attached directly onto your skin. So these 2 devices communicate via radio frequency, and they allow you to program your insulin dosage, program your mealtime insulin, and really control your diabetes and administer the insulin the way you need to. If I go into more specific details, the pod is actually a very small size. I don't know if you can see that, and I can't actually see myself on the screen, but this is a real size pod. It is built in, it's an all-inclusive. So in your pod, you have everything you need to operate it. This is a closed environment. It holds 200 units of insulin. It is completely waterproof, and there really is nothing that you have to do with it other than to fill it with insulin at the time you use it. There is an adhesive on the back that allows you to apply it to your body, and it will be there for up to 3 days. Moving over to the PDM, the Personal Diabetes Manager is the remote control with a built-in glucose meter. For those of you who are still testing blood glucose with test strips, there is an Abbott Freestyle Lite strip port right below here on your PDM that allows you to keep all the information in one place. So those devices are connected together via radio frequency, but they actually don't need to be together all the time. So for a signal to go from one to the other, they need to be within a range of 5 feet apart. But at any other time, the pod really is the one that is autonomous and that will deliver the insulin that has been programmed. So in your everyday, this is what you will be wearing with you, and the PDM can be, can be with you, available to you at any given time, but it doesn't have to be on your body per se. It can live in a purse, in a pocket. When you're at home, it could stay on the counter, and certainly sleeping, the only thing that you will need to go to sleep is the pod on your skin and the PDM by your night table or anywhere at home. So even if they're without range, you will still be able to receive your insulin because the pod, again, is the one controlling the insulin dosing and the time that goes by. So Omnipod is, it can be worn anywhere that you would normally inject insulin. So either on the abdomen, the thigh, the back of the arm, or the upper buttocks and lower back. It allows you, and it's very easy to install. Once we prepare the pod, it can go anywhere on the site, and you can change, and you should actually rotate from side to side at a cycle of every 3 days, so that you never have to go back to the exact same place. The fact that it is not attached to a tubing also means that you never have to get disconnected from your Omnipod. So from the time and from the moment you lay it on your site, it is there for you for the next 3 days. You never have to remove it. You never have to touch it. It only has to stay there, and you will control your insulin delivery using the PDM. I would ask our technology team, I'm going to stop presenting and maybe do a quick live demonstration of how to quickly set up an Omnipod. Okay, so I have here pre-prepared for you a pre-filled syringe with my insulin, and I have a pod that is ready to be started. So very easily, if I turn on my PDM, and let's just try and do this so that you can see it, you folks at home. I'm turning my device on, and it's telling me I need to confirm. There we go. And we will simply read the screen that says no active pod. Would you like to activate a pod now? And I can very easily say yes and follow some of the instructions. The navigation is predetermined to, to make it very easy for you. So you just need to read the steps and see where it takes you. So fill a new pod with insulin. After filling pod, listen for 2 beeps and then press the next button. So again, I have pre-filled my syringe, and I will inject. If you can see right here, you may see or may not a small arrow pointing to a fill port right here. So all I will need to do is to fill my insulin inside the port. Gently goes in. I don't know, you may or may not have heard the 2 beeps. And then I'll go to my next screen. So upon clicking the next screen, you see that my priming is being sent automatically. So my pod is currently clicking, and it is priming automatically. There are no manual steps for you to take. So the 2 of them are now synchronized. The pod has been programmed with your insulin doses, and it will be ready to go in just a moment. That priming step takes approximately 30 seconds. So normally during this time, you would clean your skin, determine where you would insert the pod. And one of the great features of Omnipod is that upon setting it up on your skin, you actually will deploy the needle automatically afterwards. So the auto insertion cannula feature is unique to Omnipod and allows you to never have to touch a needle, never have to see the needle, and it inserts systematically at the right angle, which is approximately 50 degrees, up to a depth of 6.5 millimeter every time, all the time. So we are ready to go. If I can share my screen, it says that press the next button to insert the cannula and begin basal delivery. So I will do that, and I don't know if you will see this, but I will remove the pod's needle cap right here, and in approximately 5 seconds, you should see the cannula appear on its own. Here we go. So from this moment on, the pod is set on your skin. You can put your clothes back on. We don't have to touch it. We don't have to feel it. As long as the pod is on you, you never have to disconnect from it either. And you can just free to go. and do go back to whatever it is that you were doing. Setting up a new pod is approximately 3 minutes from start to finish, and you can just quickly move back to what is most important to you. Is just going back to your real life. So folks, I'm going back to sharing my screen. Here we go. So we did see step 1, 2, 3, fill a new pod with insulin, apply the pod to the infusion site, and press start to insert the cannula. As quickly as that. Of course, in comparison to multiple daily injections, we will reduce the amount of needles approximately by 14 folds, because while most people will do anywhere between 4, 5, up to 6 injections per day, Omnipod allows you to insert 1 needle for a maximum of 3 days or up to 200 units of insulin, and certainly provides better quality of life, less needle. I think that most people that move over to an insulin pump will agree that though you may not object to those injections, once you are free of them, it really certainly feels good, and it does improve the quality of life that you have every day. Quality of life certainly is something that comes about quite often, because there really is no vacation for a chronic disease such as diabetes. It's there every time, all the time, and you have to think about it in different times throughout the day. So every time you eat, every time you move, every time you do anything really in life, you have to consider your diabetes. So the amount of distress that is discussed and known and associated with type 1 diabetes is quite high. So we thought as a company that the simplicity of the device should really have an impact, an important impact on the lives of people that we service. So we've asked Dr. William Polonsky, who is a specialized psychologist in type 1 diabetes, to analyze and basically review Omnipod and its use on over 1,200 adults. Most of these people, actually half of these people, came from multiple daily injections, and the other half roughly switched from another 2 pumps over to Omnipod. And we asked this group of people to answer two questionnaires, I should say. One about their perception prior to starting Omnipod, and another one in comparison after they had started Omnipod. So you can see here on the graph that the amount of people that reported improved quality of life on their own perception of their control was improved by 73%, which is really, really significant. The amount of distress they felt related to their diabetes was improved in 70% of the cases. Overall well-being of these 1,200 patients improved by 54%. And the safety associated with the risk for hypoglycemia had improved by 51%. So again, I've seen it personally, having so many people come to me from either they're using insulin pumps right now and they're switching over to Omnipod just to really try the tubeless feature and the comfort level that is associated with Omnipod, and all of the other patients that are currently doing MDI and wanting to improve their control and improve their quality of life. There really is something about Omnipod that resonates with comfort and freedom of doing what you want to do without any physical constraints to your body. So I thought it was important for me to bring that up to you. So another question that I get asked all the time is whether or not Omnipod plans to integrate CGM technology with our systems in the future, and the answer to that is a big yes. That being said, integration is something that we all look forward to. but it does present some challenges in terms of the complexity of the devices, and certainly integrated device cannot be disintegrated. The fact that Omnipod gives you the option to combine it with the system of your choice. So not only can you, but you should continue testing your glucose on a daily basis and many times throughout the day. But the method you choose to test your blood sugar is completely up to you. Either one of them can be combined with Omnipod. It really is your choice. So in the past couple of years, I would say that most patients that I've come about are either using the Freestyle Libre or the Dexcom. But let's face it, CGM technology can be expensive, and not so many people have access to it. So if you're still doing test strips, or if you do have access to CGM technology, it really is about giving you the option. I should tell you that Omnipod does have an official partnership with both Dexcom and the Freestyle Libre. So we definitely are working in partnership with these two companies to bring to market integrated technologies in the future. Now, also want to talk to you about DiaSend, which is a web-based program allowing you to download your device and giving you and your healthcare team access to your data. Having data is so important nowadays, and the access to technology, we know now more than ever that having access to technology and communication with everyone around us is so important. So I know for myself in Montreal, many of my clinics have very quickly moved to telemedicine. I know some of my endocrinologists are hardly seeing patients in person, only those that may have complex situations that need to be addressed. But most of the endocrinologists here in Montreal are seeing patients by telemedicine. So being able to provide your healthcare professional and your physician the data associated with your diabetes is something very important. So your PDM gathers 90 days worth of data. So everything that is either recorded or input into the device is recorded for 90 days, which means all of your glucose testing, your meal boluses, your carbohydrate intake will be programmed. Of course, your basal rates and your insulin at mealtime will also be recorded and presented in a graph form and shared with your healthcare team. So I should say that DiaSend, which is now called Gluco, is also compatible with any of the other systems that you may be using at home. So you can actually combine and overlap different glucose meters. The Dexcom is also compatible, so you can overlap your Dexcom information, some of your Freestyle Libre information if you're using the original glucose meter that comes with it and not your cell phone, and again, overlap the information with your pump device information. So, for those of you who might be interested in trying Omnipod, I do invite you to order a free demo kit. Inside the demo kit, you actually have a pod, a real pod, same weight, same size, and with an alcohol swab that you can try Omnipod and see how comfortable you are, see where on your body you are most comfortable, and get a feeling for what it might be to be wearing Omnipod on a daily basis. Anyone that may be interested, upon purchasing a system, you do have a 90-day trial period. So if you decide that you are willing to give it a try, we can, first of all, basically provide service to see how you may be reimbursed by your insurance, or if you are eligible to a reimbursement program by your local province, wherever you may be tonight. And we do offer 90-day money-back guarantees. So at any time after your training, up to 90 days afterward, if you're not feeling 100% about wearing Omnipod, you can return it without any penalties, and we will wish you best of luck. We believe that Omnipod will make that difference, that we are willing to commit to a 90-day money-back guarantee to you. If some of you may be wearing tube pumps right now, so if you're also interested in trying tubeless freedom with Omnipod, I invite you to contact us, whether on our website or local resources that I will share with you in just a moment. We do have a welcome program that was designed to allow you to try Omnipod if you're using a tube pump already. So we will provide a full system, a complete system at no cost to you. We will honor your data purchase and honor the warranty period that you have up to 5 years, because Omnipod is warranted for 5 years, not 4. And we will also train you and greet you as if you were a first-time pump user. So anyone that may be interested, if you're already using a pump, experienced pumper, but you're curious about trying Omnipod and the tubeless design, come to us and we will make sure that we hold your hand and let you know how to best use your Omnipod system. So the information that we have, actually, let me just, before I close, I just want to remind you just a few tips about the presentation tonight. Is that Omnipod and all of our teams are really here to help you and to support you and take better control of your diabetes, eliminating the need for frequent insulin injections, sleep freely without getting all tangled up in your tubing, and certainly have an improved quality of life overall. We want to be there to really help you live your life and not have the burden of living with diabetes and medical devices every day. So certainly want to invite you to call us, visit the Omnipod website, call us on our toll-free number, reach out to your local people. All of the different representatives that I work with are a great bunch of people, many of which are healthcare professionals working in the diabetes field for a long time. Also, many of them happen to have type 1 diabetes themselves, so I'm sure they'll be happy to answer any questions that you may have and assist you in any way that they can. So thank you very much, everyone, and I'm open, staying here for any questions that you may have. Merci beaucoup, j'attends vos questions.
Thank you so much, Gabby. That was very informative. We do have a lot of questions that did come in, so I'll just start with the first ones that we receive. The first one is, if I lose my PDM, can I still bolus?
So actually, losing your PDM means that you will keep receiving your basal insulin, but you will not be able to bolus at mealtime. So on a short-term basis, your security plan is to always carry an insulin syringe or a pen device with you so that you can bolus at mealtime if you lose your PDM or if you have forgotten it. If you lose it, I should say that if you call our toll-free number and speak to our technical support folks, they will replace a lost or stolen PDM at any time. So you have a free replacement for lost and stolen once, and anyone that is using an insulin pump should also contact their home insurance to make sure they have extra provision for lost or stolen devices, whichever device that may be. So I should say that the PDM replacements are delivered at your doorstep, probably within 2 to 3 hours if you live in a big city area. In the remote areas, it could take a few extra hours, but in general, within the first 6 to 12 hours, you will likely be receiving your replacement PDM. So you really shouldn't be a long time without a PDM and be able to get back on your feet quickly.
Thank you, Gabby. So we'll go to the second question. Is it smaller than the older version? So I'm guessing we're talking maybe here regarding the pod.
I actually happen to have one. Let me reach out for it. This is, so this was the very first generation pod. And this is the pod today. I hope that you can see this. There is a very big reduction in length, width, and thickness of the pod. So it's approximately a reduction between 40 to 50% size, and still allowing for 200 full units of insulin inside the reservoir of the smaller pod. So I believe that change occurred before I joined the company. So I believe it was about 4 to 5 years ago. But this is the current size in comparison to the previous size. Certainly allowing for more people, especially smaller bodies, to feel, you know, less discomfort wearing a device that size.
Perfect. Now a question in French from Clara. Est-ce que le pod tient bien sur la peau, même si on transpire en faisant du sport, par exemple, ou s'il fait chaud?
Oui, bonjour Clara, merci beaucoup pour la question. Alors, effectivement, il y a un adhésif derrière le pod qui permet de porter l'appareil directement sur la peau. Normalement, ça ne pose pas de problème. Bien entendu, comme tout appareil médical, ce serait important de bien nettoyer la peau. Le nettoyage de la peau avant d'installer le pod est crucial. Alors, nettoyer la peau, désinfecter avec un bon tampon d'alcool, coller le pod avec une technique qui est bien sûr enseignée et normalement, ça tient pendant 3 jours de temps sans problème. Si c'est problématique en termes de transpiration, sudation, surtout des activités aquatiques, normalement, on peut utiliser, surtout en période estivale, je pense un problème qui revient de façon très saisonnière. On peut utiliser des substances collantes telles que le Skin Tack, entre autres, qui est un des produits très utilisés pour augmenter l'adhérence au site. En général, ce n'est pas très problématique par contre.
Now a question from Penelope. Are there any Keystone strips that would work with the integrated glucose meter in the PDM?
Hi, thank you for the question. Unfortunately not. So there are no ketone testing test strips to go with the PDM. It really is only for blood glucose testing. You still need to have and use a ketone meter whenever you need to on the side.
Now a question from Debbie. Is there only a choice of plastic cannula or is there a choice to get a steel needle instead?
Unfortunately, no, there is no steel needle available. This is a really, truly one-size-fits-all, all-inclusive, integrated device that you know, is in a closed environment. So there are no cannula option. This really is a standard device that is used for everyone. This is an approved product for anyone, no matter which age, no matter which type of diabetes. If you have diabetes, Omnipod is a device that is approved for you, but no option for steel cannula at this time.
Thank you. Now a question from Peter, a very good question that I'm sure many parents would have. What happens if I make a mistake entering the number of carbs? What will happen, and can I cancel the bolus?
So thank you again for the question. Certainly as parents, you know, caring for children, we certainly want to make sure that we keep them safe. So if you fear you've made a mistake and the bolus has started to deliver just now, you do have a cancel button. So you can just push on the button and quickly cancel the bolus that is currently being delivered. You will be notified of how much insulin was administered during that short time frame. Of course, if you made the mistake and the bolus went all in, there is no way that you can cancel or call out insulin that was already administered. So you will need to go quickly to plan B and feed your child with some additional carbohydrates if the bolus was administered entirely.
Okay. Now another question that just came in. Just to confirm, the 90-day money-back guarantee starts the first day of the pod is applied or another date?
So just to be clear, we have a 90-day money-back guarantee that will start upon your pump training. So from the moment you start using your pump, and we do provide training. So everyone starting on Omnipod is offered a training with a certified pump trainer. They are trained by Omnipod and they will follow you for up to 30 days in general. During these times, we tend to be a little bit more flexible with the times and the training methods because we've been doing virtual trainings for the past 7 weeks. So we are adapting ourselves to new methods and new ways of doing things. But the 90 days starts upon the day of your training. And if you're not entirely pleased, we will honor it for up to 3 months after you started.
Perfect. I think that was most of the questions that we had for tonight. Gabby, any last word of advice with the Omnipod product?
Well, I'd just like to thank everyone for being there and have me into your home. Really was a pleasure being here. Thanks, Kim, to you and to your team for making it as comfortable as can be. This is something that we are bound to get better at in the next few months. So again, I invite you to reach out to your local teams at Omnipod or visit our website, call our toll-free number if you have additional questions, which I may or may not have answered for you tonight. We're happy to be here to help you and to support you. So good continuation. Keep healthy, everyone. This is really what's on top of mind right now, and hope to see you in person real soon.
Thank you, Gabby, for this informative session, and a huge thank you again to our event sponsors, Omnipod, Sun Life, Bell Media, Sunripe, Abbott Diabetes Care, Tandem Diabetes Care, Lilly, and Medtronic for making these sessions possible. Again, a recording of tonight's discussion will be available on JDRF's YouTube channel in the coming weeks. Thank you for all of those that already registered to the JDRF Party for a Cure on Sunday, June 15th. So just as a reminder, tonight is part of the JDRF House Party for a Cure kickoff week. So if you haven't registered yet for our party that will take place on June 14th, we invite you to register at jdrfparty.ca or in French, frdj.ca. And you can have more information there. You can register, invite your friends, family, create a challenge to raise money to push type 1 diabetes much further until there's a cure. So thank you, everyone, for your participation. And you can tune in for the rest of the week for different information sessions. Thank you.